Breast cancer is the most common cancer among women worldwide. Statistics suggest that 1 out of 8 women will develop breast cancer over the course of her lifetime. This month, there have been several activities, campaigns and events going around in Doha to spread awareness on this. But I still believe definitely we need to do more towards this cause. Hence, luckily today on the set, I have with me Dr. Kulsoom J V3, a consultant breast surgeon in Hamad Medical Corporation since 2011. So viewers, let's have a complete knowledge of breast cancer and hear it straight from the person herself, Dr. Kulsoom J V3. Assalamu alaikum, Dr. Kulsoom, and welcome in Spotlight with Zunira.
Walaikum assalam wa rahmatullah, and thank you very much for inviting me here for this very important cause to spread breast awareness amongst our ladies.
Our pleasure. So Dr. Kulsoom, cancer. First, let's speak about this disease. What is cancer actually?
Right. So if you say cancer, we say that it is an uncontrolled division of abnormal cells in the body. Okay, this is kind of a definition of cancer if you say it. And it can be anywhere: breast, liver, lungs, skin, colon, anywhere. And God has made us really foolproof in our body for growth, for replacing the damaged cells. The cell division happens. The cells replicate to replace the damaged cells or for the growth of our body. So there are certain checkpoints at the replication of these cells, at the division, or we call it a cell cycle. So for some reason, if these checkpoints, they get lazy or they are altered or disturbed, then the cells go into abnormal growth and uncontrolled growth, and that causes cancer.
And what are the reasons that they go under that phase?
Now there are different reasons for different cancers. As we know that smoking is implicated in lung cancer, there are certain risk factors for breast cancer, there are certain factors for colon cancers. So every cancer has its own risk factors, but there are certain very general risk factors which I'll talk about as we go on. Yeah. Okay. And just a general knowledge, general information I would share with you. When we talk of cancer, the word cancer, where did it come from? It came from Hippocrates, the father of medicine, the Greek physician. And he named this disease as cancer because when he cut open the tissues of those people who died of cancer, he saw that this resembles a crab. And to crab in Greek, they called karkinos. And from karkinos, it came as cancer or carcinoma. So that is how the word originated. But having said that, he was not the first person to discover it. We find breast cancer description in very old Egyptian documents dating back to more than 1500 years before Christ. So it's quite an old disease, but now we have the diagnostic modalities, we diagnose it early and we know about it more. So that's how it is.
So earlier people were dying out of it and there was no cure to it.
Exactly. Previously they called it incurable disease, and they used to cauterize or burn the tissues to just limit the disease.
And also, you know, there is something with the snake flame as well, right?
Yeah, that
used to be done at earlier ages.
They used to burn it and they called it fire drill and all.
So let's talk about breast cancer.
Right.
What are the symptoms basically, and how do you know that you do have it in you?
Right, okay. Now, breast cancer, as we know, breast consists of milk producing glands and the tubes which carry the milk out to the nipple. So the commonest cancer of the breast arises from these milk tubes. Okay. And the other common type arises from the glands, of the milk producing glands. So these are the two major types of breast cancer. And what are the symptoms? How can the ladies know about it? The most common symptom is ladies discovering a painless lump in their breast.
A painless?
Painless lump in their breast. pain, when they say they have pain in the breast, I say that's music to my ears.
Okay.
Because pain is, they are painless in more than 97% of the cases. So, but having said that, if somebody is coming with pain, that doesn't mean that you ignore it. No, you have to assess it to rule out the other causes. And then there are various other symptoms as nipple changes, some bloody discharge from nipples, or any other, even colorless discharge from one side, which is just coming by itself, not on expression, or any change in the size of the breast. I remember one of a very young lady, she came to my clinic. She was just, I think, in her late 20s. And she said she feels that her breast, one of the breast is kind of increasing in size. And she has been to various doctors and didn't have any answer. And that had been going on for about a couple of months, more than 6 months. And when she came to the clinic, it was a frozen breast. She had that cancer sitting there for a while, unfortunately, and she was not diagnosed.
But how come at a young age she's not even a mother, I'm sure?
Yeah, age is, well, it does happen with increasing age, but that doesn't mean that the young age is they cannot have. No, young age can also have cancer, breast cancer.
This is something I'm getting to know first time.
Yeah. So our youngsters, our girls, that's why when we do breast cancer awareness campaigns, I specifically tend to cater the high school girls. Because that is, if you, as in Islam we say, if you educate one woman, you are educating the whole family. So we can start from that, educating our young generation, and they are the ones who spread the message, who become aware, so they can take care of their family.
Exactly.
So coming back to your question that yes, what symptoms? Yes, it is, as I said, breast lump, changes in the nipple, changes in the size of the breast. And of course, any lumps found in the armpit, that is again important, because breast cancer spreads from the breast to the glands in the armpit. They are called lymph nodes. So any lymph node becoming enlarged and nothing in the breast can also be suspicious.
Okay, but getting a lymph node is something very common, and you can find it with every other lady, but it's not necessary it's cancerous.
No, not necessary. As even the lump, when the it's 80% of the lumps are benign. Not necessary that every lump is a cancer. No, out of 100, 80% are benign. So it is just that you have to go to the right person to have it checked and ruled out. So that is what we say.
So what do you suggest, doctor? What is the best age to go for your first annual checkup or mammogram?
Right. When we always advise our girls that have breast self-examination, be breast aware. You are at the age of 20 and above, as you are pubertal, you should know what your breast feels like. So if you examine your breast, I was just advising someone that they said, what should we feel? How do we know what to feel in our breast?
Exactly.
Right? This is a very common question you get. So just if you feel your breast and once you feel it, you feel, okay, this is it. In the next phase of your menstrual cycle, if you feel it again, if you feel anything different, then you go to a specialist. 20 and above, you should start your breast self-examination. At least initially we say once in 3 months, then 30 above, once in a month is good enough. And 40 above, we say mammographic screening is advised. So in Qatar, we have started the National Breast Screening Program. Here we screen the ladies 45 and above, okay? And for screening, I would suggest that those ladies who are 45 and above, they should approach their health centers, because it is very much with the health centers, and there they can have the screening done, and if there is anything, they will be automatically referred to our clinics.
Okay. Yeah. Okay, now tell me, who are the people most at the risk of having it?
More than 80% of the cases, we don't know what causes it. Okay, so we can't pinpoint a cause. But yes, certain risk factors, we say that these are the things which can be a factor causing it, or a synergistic effect on causation of the breast cancer. So when we say that, there are certain hormonal risk factors, there are certain factors which could be modified, and 15 to 20% we say yes, that is a family related breast cancers, and just in 5% of cases, or less than 10% I would say, we have the genetic mutations, right? So these are the common genetic mutations of BRCA1 and BRCA2, as you must have known about Angelina Jolie, the celebrity, who was found to have this BRCA mutations, and she had both breasts removed. So these are the cases who have these genetic mutation, who are definitely the high risk groups. Right, and the other risk factors, as I said, the hormonal risk factors, and as having the start of the periods at an early age, and stoppage menopause at a late age above 55, and start periods before 12 years, and these having first child at a later age, 30 or above. So we always, as previously, of course, when women were married, they used to have finished their family early. But then a trend came that women used to think, okay, let me finish my career things and then I'll get on with my family. But that is not right. If you have a child at a later age, 30 or above, that is a risk factor for breast cancer. So we advise our children to that it's better if you are married, you start your family early.
At early
age.
Okay.
And then breastfeeding, yes, breastfeeding, but if you breastfeed your child for a year or more, yes, you decrease the risk of breast cancer, but all these things, they are risk factors. That doesn't mean that if you're doing all these, you will not get breast cancer.
Yeah, because women, they are breastfeeding for 2 years and more, and still they are affected.
They are still affected.
And what about the ladies who are like, after the feeding is done with the kid and they take medicines to dry their milk? So I've heard that these are also one of the reasons, or no, nothing
Not really.
related to it?
There's no scientific evidence that proves that can cause these milk stopping medication can cause that.
Nothing like that.
That is just a myth. And yes, the recognized risk factors, as of course we are in a Muslim country, alcohol consumption, that is again a risk factor. Smoking is a risk factor for breast cancer as well. And
even
obesity,
you mean shisha as well, not only
yes, of course, even the passive smoking, somebody is smoking in the vicinity and you are there. Obesity, so, and lifestyle. I mean, our children, we are growing our children who are sitting in front of the television. Whenever they come back from school, they're in front of TV, they're in front of the computers, laptops, iPads, whatever.
Exactly.
And we don't promote physical activity for them. I mean, the mothers are busy chatting on phone, they are busy with their kitty parties. They don't take care of that. This is where we are really, we have to be proactive.
Exactly.
We can beat this beast only with our efforts.
Exactly.
If we just let it go, oh, that's all right, it's going on fine, our life is going smooth. That is not the answer. We have to work to defeat this beast.
Yes, we have to put an effort to.
We have to put an
it.
effort,
Exactly. Very
because
well
if we educate our children to involve more in physical activities, be more play more outdoors or indoors, but be not sitting in front of the TV or a couch potato taking burgers and chips all the time. That is not right. And of course, diet is a very important factor.
I was about to ask you this.
Yeah, diet is a very important factor. I'll tell you a recent study in one of a reputable journal. They were doing a study to see that how does Mediterranean diet affects the cardiac diseases incidence. And it was just an incidental finding which they found that the breast cancer incidence was low in those cases who were in the positive arm group, that is, they took Mediterranean diet for that time period.
Okay.
So what is Mediterranean diet? It is more of the plants and veggies and taking more virgin olive oils and fish and less of a red meat and things. So it is very important to take care of your diet. It is not just breast cancer, it's colon cancer, it's lots of other cancers are implicated with that. So diet, 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 that is very important key thing.
So I think, I believe lifestyle basically.
Absolutely, lifestyle changes.
Your lifestyle makes a lot of difference.
Lot of difference.
And with that you can cure so many things in life.
Absolutely right.
Okay, Dr. Kulsoom, sometimes there are conflicting views of doctors for the same patient, and this is something which has happened here with a woman. So this lady was telling me that before she was diagnosed that there is nothing, and then later on, after 2 years of her life, she was actually diagnosed with it.
Okay.
Just because of the confusions of the doctors. So in this case, particularly, what one person should do?
Right, okay. I would answer it like this, that you have to choose the right person, right? If you're having a problem for breast, you should go to a breast surgeon. You should not be going to any other specialist, because we in Hamad, we are the specialized breast team. Nowhere in Qatar you have any specialized breast surgeons. We have a breast team who are specialized breast surgeons, trained in breast surgeries and breast cancers in Hamad. So ladies here in Qatar, if you have any problem, they keep on going to even private hospitals, whatever. We say that we provide you the best service in Hamad. And Her Highness, she started a program that the suspected cancers should be seen within 48 hours by a specialist. So that is a very successful program, and we are achieving the targets. And if you are feeling anything, the best thing is first go to your general practitioner. And once because we in Hamad, we charted a forms of urgent referrals with suspected signs of cancers, which were distributed to all the general practitioners in Qatar. And they know that if there is any sign out of those, they have to refer the patient to the specialist in Hamad, to us, within 48 hours. The patient should be seen in Hamad, and they are seen in Hamad.
Okay, I have a question here. What if you don't want to go to these practitioners and directly somebody wants to approach one of the doctors in Hamad?
Yes,
What is the procedure for that?
We do get walk-ins, but we're trying to cut that down, the walk-in, because our clinics are already overloaded with the patients who've been waiting for time for so many days or months or weeks.
That is true, yeah.
And then if we start catering the walk-in patients, that will be injustice with those ones who are already scheduled. So that's where we are trying to smooth it out, that people should have the culture of going to their primary health centers and from there get referred. So it is all streamlined. Right?
Okay.
So that there's no injustice with anyone. And coming back to your question that there were differing views, yes, if you don't go to the right person, you will have differing views from different doctors. And in Hamad, when we have any patient in whom we are suspecting that there is some cancer or something wrong, then we call it triple assessment. They have examination by us. They have the imaging done, that may be ultrasound, that may be mammogram, that may be MRI, depending on the age of the patient, depending on the presentation of the patient. And then if needed, we do a biopsy. That is putting a needle in and taking a piece of tissue out for diagnosis. So this whole thing is called triple assessment.
Is it painful?
We give local anesthesia for biopsy.
Okay.
And there is a common myth which I want to clear from your platform, that they say if you put a needle in the cancer, cancer spreads. There's nothing like that. It does not spread. Getting the information is far more important than sitting and doing nothing, and because of the risk that it may spread. Okay, so that is just a myth which should be clarified. Every lady coming to my clinic, if I suggest a biopsy, the first question they say, no doctor, I don't want a biopsy, you take it out. I said, no, we have to diagnose it, we have to have a roadmap, we have to have a plan for your treatment. So we just can't be doing surgery and taking it out and ending up again in more surgeries. So
Okay.
yeah, so that is the way forward, and that is how it should be.
And one more thing, doctor, I'm sure you would agree with me that ladies, basically, even educated ladies, even me sometimes, when I think of going for a mammogram or doing that, we are scared. We are fearing the fact that what if something comes out.
Absolutely right.
And this is the feeling which make you lazy, not actually lazy, but this is something,
Scary feeling, yeah.
feeling within you that you are not, forcing yourself to do it.
Yeah.
And we are just avoiding the situation.
That's
so,
true.
what do you have to say for these ladies? And I know many ladies are facing the same situation.
I understand, absolutely. I can only say this: if a cat comes to a pigeon and pigeon closes the eyes, that doesn't make the cat go away. So you have to be brave enough to face it. You have to and as I repeatedly say again and again, you have to know your body. So please do breast self-examination again and again, once a month, once in 2 months, once in 3 months. And if you find any persistent change, go to the specialist.
Okay.
Yeah.
Okay, another thing, doctor, like not every lady is strong enough to battle this fight. I've seen some ladies who are not internally that much strong, and everybody have different issues with their bodies. So what do you suggest for such people? Like, do you tell the patient right away that would you be able to fight this out or no? How do you deal such ladies? I mean,
you mean those ones who are diagnosed with cancer and they don't? Okay, we have a very specialized team. We have surgeons. We have our clinical nurse specialists who are specialized nurses who deal those ladies, who counsel those ladies who have breast cancer about the various treatment options. And once we break the bad news, we tell them the treatment plans, then they have a detailed discussion with the nurses because of the shortage of the time. We can't be sitting with them for a long time. So we ask our CNS, we call them. They sit with them, they go through the details of the treatments with them. If they have any questions, I always say to my patients, next time when you come and see me, bring a piece of paper with lots of questions. So all the questions you have in your mind, put them on your piece of paper, bring them, so I should answer your questions right away instead of you keep suffering from that. And those ladies which, despite of all these discussions, we don't just see them once, we see them repeatedly, and we make sure before they are gone for the treatment or they've started the treatment, all the doubts or their mind is clear about what they are going to. And if they are still not ready for it or they are scared of it, then of course we have breast cancer survivors who can help them out, and we have our psychologist who can help them out. So we have support for them, and we have
there is a complete consultancy and psychological
yes,
treatment
absolutely,
as well.
psychological aspect, because it is a psychological trauma.
Of course,
if you see, it's a major psychological trauma for someone being diagnosed breast cancer out of blue, and they say, we were all right, what happened? Especially those with the screening mammograms, when they come to us that, oh, we were okay, we just went for a screening mammogram and they found something and it's cancer. So they are kind of that we don't feel anything. Why it is? Why is it cancer? So mammogram can detect breast cancer 2 years ahead of any clinical presentation of a lump. Okay. So that's why we say the breast cancer incidence increases with increasing age. That's why we say 40 and above should go for the screening mammogram. So if they have anything, it would be diagnosed earlier than it becomes clinically presentable. And the other thing is, having said that yes, they do diagnose cancers 2 years before they become clinically palpable. Not 100% cancers are diagnosed on mammograms. So mammogram also have their limitations. 10 to 15% of the cases can be missed.
Okay.
Yeah.
So you can not only rely on mammogram.
No.
It means.
I had one patient, she had a lump in her breast. She came to me. She had all sorts of imaging from before, MRI, mammogram, everything, and nothing showed anything. And when I examined her, she had a mass sitting there. I biopsied her, she was cancer. I operated on her. She had a 12 centimeter cancer sitting in her breast.
Oh my God.
So, so that is the thing.
She survived.
Yes, Alhamdulillah, she's survived. So that is the thing, that it's not just one thing. That's why we call it triple assessment. It is our specialist examination and imaging, whatever imaging modality right for that patient's age, and if needed, biopsy.
Okay.
So
3 stages you need to go through.
3
so
things.
Is it like every year you do all these 3 or no?
What do you? No, not every year. I'm saying when the patient is coming first time to you, then for diagnosis. It's not that every year. Once you have diagnosed breast cancer, then that is gone for the treatments. Then it's not that you do.
Let's talk about the mammogram thing.
Yeah.
You said after 40 we should have a mammogram. Then is it once in a year and then we go do it again in next year, or what should be the time period in between the checkups?
Every country has their own age for the screening mammograms. As when I was practicing in London, our screening age group was 50 to 70. And then now it is decreased from 47 to 73. So in Qatar, in Doha, we have 45 onwards, 45 to 70, I believe. This is and the duration between the 2 mammograms is again dependent on different screening programs. And here we have 3 years. Every 3 years you should have a mammogram, and depending on the risks, if somebody because of the family history of breast cancers in the family, or because of the genetic mutations, they fall into high risk category, their screening is a different ball game. They are screened differently. They will have more frequent imaging as compared to the general population.
So basically
screening.
This is what doctors decide for.
This is what doctors decide, yes.
Keeping
absolutely.
in mind your history and everything around you.
Yes.
Okay.
And I would tell one thing more, that we have a genetic counseling clinic in Hamad, and those ladies who have breast cancers or ovarian cancers in their 1st or 2nd degree relatives, we send them to our genetic counselor to assess their risk category and risk status. And then, if needed, they will be offered a blood test to know any mutations or changes in their genes and to assess their risk.
Okay. Coming towards another issue that I've been receiving these questions from ladies.
Sure.
One lady was interested in knowing that what about wearing a bra 24/7? Like usually you see young girls as well, ladies as well, they are wearing it all the time. So what are the suggestions for that?
Bra has absolutely no problem. You wear it 24/7, you don't wear it, nothing to do with the causation of breast cancer. Wired bra, non-wired bra, nothing to do with it.
Okay. What about
it is
while
just
sleeping?
this, that while sleeping, if you want to wear it, you can wear it. If you don't want, that's absolutely your decision.
Is it something a serious thing, or
no,
one should
nothing
avoid
at all.
it?
Nothing at all.
Like that. Okay.
And it is just that I would say that wear the right size bra, because ladies come to us and they have the imprints of the bra on the breast, which shouldn't be, and then they say we have pain, because the bra is not
too
properly
tight,
fitted. So that's why they have pain. So just wear the right bra, and whatever time you want to wear it, it's your choice.
Okay. Doctor, coming towards this very important topic, which is breast implantation. Does it cause cancer?
Breast implants are not the reason for cancer, breast cancer. Okay, so ladies have breast augmentation, they use breast implants, but they do not cause breast cancer.
Nothing to do with
Nothing to do with it. It is just that we say that the diagnosis of breast cancer can be delayed in these ladies because of various reasons. So again, we say that self-examination and examination by a specialist is important.
Okay. Now, once you have survived and battled the fight, how free you can be afterwards, or what are the risk factors for that patient who has survived it?
Right. Now, the ladies who have suffered breast cancer once, they are always at an increased risk of getting breast cancer again
Okay.
as compared to the general population. And the risk of recurrence, of course, depending on the biology of that particular cancer, what that lady is suffering from. But in general, it is 1 in 10 will have a recurrence of breast cancer. So if you in 1 year, so if you say in 10 years, if you have treated 100 patients, 90% will be fine, but 10% will come back with another cancer there.
My other question for you is, what are the best treatments
Okay.
that you can take?
Yeah, when we talk of the treatments for breast cancer, broadly speaking, it is divided into surgery and the special type of medicines which are called chemotherapy, and then special rays, they are called radiotherapy. Okay. Now all these three things combine to treat breast cancer. Not one thing is sufficient. Okay. Quite a lot of times ladies come, oh, chemotherapy, no, that is, I'm going to lose my hair, no, doctor, please, you do surgery, take the tumor out, I don't want chemotherapy, please don't. But this is not the answer. The life is important, your survival is important. Just because of the aesthetic reasons, you cannot say that we don't want this part of the treatment, we can only do this part, right? Because if you lose your hair, the hair come back.
Yeah.
It is not that it's a permanent hair loss. It is thinning of hair, but the hair come back, and ladies are happy when they have a hair come back. And when we are planning for chemotherapy for them, we do advise them that do look for some wigs for yourself, so during that period you don't feel embarrassed going out in public or so, and that really ladies do well with that. So when I say chemotherapy, it is broadly, it could be said systemic therapy, because one is chemotherapy, the other part is hormone therapy. Depending on the type of cancer, we give these treatments, and then the hormone therapy is the one which is prolonged, which could be given for 5 years or 7 years or 10 years, depending on the type of cancer, on various factors of that patient.
Okay. Now, what about the side effects of tamoxifen?
Yes, there are various side effects of tamoxifen. This will be a very specialized question. I would say that it's better if I say too many side effects here, ladies will be unnecessarily scared.
Yeah.
So those only who need tamoxifen do more. All these things, we weigh the risks and benefits. So if the benefits are more, only then we suggest that particular treatment to the patients. Yes, tamoxifen does have side effects of causing uterine cancers or causing these clots in the legs, but then again these risks are less than the benefits it gives you of preventing the cancer coming back. But again, it is only given in those ladies who have hormone positive tumors. And generally speaking, if the ladies think by taking tamoxifen, even a normal woman, the cancer will not happen, it is not like that. So the normal ladies don't have to take tamoxifen. It is a specialized treatment just for the cancer patients.
And only take under the
medical supervision.
Yeah. Okay. Okay, now talking about Hamad Hospital, are there 3D mammography facilities available now?
It is called digital mammography. Yes, it is very much available there.
Okay.
And we have very specialized machines and good team.
So let's talk about the stages and the risk factors for every stage.
Right. Okay. Now, when we say stages of breast cancer, we have 4 stages. Stage 1 is stage 1 and 2 are the early breast cancer, in which the tumor is confined to the breast, or it may have just gone to a few glands or lymph nodes in the armpit. Stage 3 is the loco-regional advanced stage. That means there is a bigger size of cancer sitting in the breast, there are more lymph nodes involved in the armpit. And stage 4 is the stage when the cancer has gone beyond the constraints of the breast and the lymph node and spread in the body.
Which is the
which is in the first 3 stages, yes, we say that it is treatable disease. But the last stage, when we say it is a palliative treatment, it is not a curative treatment in that case. So earlier detection is the answer, and if we detect it early, previously, if you talk of breast surgery, previously, say early in late 80s or so, or early 90s century, ladies used to have the breast removed, the skin over it removed, all the glands removed. But as it all evolved and the adjuvant treatments became more into, then we have started conserving the breast. And now we don't need to remove the breast in all cases. It is just if the tumor is in one area, we just take that area out. And I'm a trained oncoplastic surgeon, so we kind of shape the breast in a way that when the ladies, they look themselves in the mirror after surgeries, their breast should be acceptably shaped. I wouldn't say that we can create the same breast as God has created. We cannot do that. But we give them an acceptable shape, so when they see themselves in the mirror, every time it doesn't remind them of their disease. Because that is a psychological trauma they will have every time that they see themselves, and that reminds them of their disease.
Exactly. Wow, that's really good. Okay, now I want to talk about the role of alternative medicines. Like once you are under the chemo and you're going through some medication for breast cancer, are you eligible to take other medication as well at the same time or no?
I would say we don't have as yet the other medicines are really shown a success. I would say they haven't shown a success as yet. And conventional medicines, what I've already described, surgery, systemic therapy, radiotherapy, these are the treatments which have shown the success. These are still the gold standard of treatment. And lots of ladies, they come, not lots I would say, but some of the ladies, they come and they are diagnosed. I break the bad news, and then they say, doctor, we want to try something else. Okay, fine, go ahead, it's your choice, your body. We can only advise you what is right for you, but if you want to try something else, yes, go ahead please. And every time it happens, they come back with the advanced stage then. Because they have tried herbal medicines. I don't want to be rude to other medicine fields, but unfortunately, whatever things they try, nothing works, and they come back with the same sort of problem at an advanced stage, when at the earlier stage they could have been cured, but they come in a late stage. Now it's just a palliative treatment we give them. So unfortunately, so far I would say there's nothing comparable to the standard, gold standard treatments what we are offering.
Okay. Dr. Kulsoom, I think we have talked enough and we covered most of the issues within the field of breast cancer, and I'm really grateful to you that you came out and you took out your precious time for us to host us for this interview, and really glad. So before we'll take a leave, just tell some good advice for our viewers.
Well, my message would be that yes, we can't control our genes, but we can change our lifestyle. So eat healthy, live healthy.
So viewers, it's time for us to leave. Take a lot of care of yourself. Early detection is the best prevention that one can have. Take care. Bye.